In this picture, a medieval German woodcut depicts the temperaments of the cold and dry qualities of the melancholic disposition, which were associated with old age, retentiveness, and scholarship, like the old man depicted here with his head resting on a table. The second image, the hot, moist man representing the sanguine temperament, is depicted as an active wooer embracing a woman. Third image, a cold, moist, phlegmatic couple prefer retirement and leisure, signified here by music. Fourth image, the hot, dry man of choler furiously beats the woman kneeling helplessly at his feet. In the human body, the interaction of the four humors explained differences of age, gender, emotions, and disposition. The influence of the humors changed with the seasons and times of day and with the human lifespan. Heat stimulated action, cold depressed it. The young warrior's choler gave him courage, but phlegm produced cowards. Youth was hot and moist. The elderly were cold and dry. Men, as a sex, were hotter and drier than women. The English physician William Harvey had dissected 80 species of animals, concentrating on the blood vessels. He noted that the valves joining the heart's two upper and lower chambers permitted blood flow in one direction only. He showed that the heart was a muscle which acted like a pump. He concluded that arteries and veins were linked by invisibly small vessels so that blood moved around the body in a closed loop. Harvey's discovery of the circulation of blood is considered as his greatest contribution to the field of medicine. His many experimental dissections and vivisections made him reject Galen's views about blood movement. In traditional Galenic physiology, there were two types of blood, the venous and the arterial, with distinct pathways and functions, relating to the three chief body centers: the liver, responsible for nutrition and growth, the heart, vitality, and the brain, sensation and reason. Nourishment and growth were secured by the venous blood originating in the liver, while vitality was conveyed to the body parts by the arterial blood originating in the heart. Arterial life-giving blood contained pneuma, or spirituous air. During this time, physicians believed blood fed the body when needed. Being there in the tissues, it would be used up. It did not return to the heart. Given the quite distinct functions of venous and arterial blood, their different sources, and the belief that they were expended, there was no belief that the heart acted as a pump during this era of medicine. Florence Nightingale was not a famous physician, but she is considered to be the founding mother of the nursing profession. She was sent to the British camp to tend for wounded soldiers. When she arrived, she was appalled at the conditions of the hospital. Rodents and sewage were all around the wounded soldiers, spreading disease. Soldiers were dying from secondary infections rather from their battle wounds. Nightingale set to work. She procured hundreds of scrub brushes and asked the least infirm patients to scrub the inside of the hospital from floor to ceiling. In addition to vastly improving the sanitary conditions of the hospital, Nightingale created a number of patient services that contributed to improving the quality of their hospital stay. She instituted the creation of an invalid's kitchen, where appealing food for patients with special dietary requirements was cooked. She established a laundry so that patients would have clean linens. She also instituted a classroom and a library for patients' intellectual stimulation. Her work reduced the hospital's death rate from 40% to 2%. Nightingale herself spent every waking minute caring for the soldiers. In the evening she moved through the dark hallways carrying a lamp while making her rounds, ministering to patients. The soldiers, who were both moved and comforted by her endless supply of compassion, called her the lady with the lamp. And this is why at graduation ceremonies for nurses, they oftentimes have a symbolic candle that is lit by all the graduates. Queen Victoria was so moved by Nightingale's work that she had a brooch made for Nightingale. Now let's switch our focus from our brief overview of medical history to the study of pathophysiology. The term pathophysiology is defined as the physiology of altered health. According to the preamble to the Constitution of the World Health Organization in 1948, it defined health as a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. The focus of this class is the study of pathophysiology, the study of the body's response to dysfunction or disease. The function of, or definition of disease is an interruption or cessation or disorder of the body system or organ structure that is characterized usually by a recognized etiologic agent or agents, an identifiable group of signs and symptoms, or consistent anatomical alterations. The aspects of the disease process include etiology, pathogenesis, morphologic changes, clinical manifestations, diagnosis, and the clinical course. I will define these topics on the next few slides. The causes of disease are known as etiologic factors. These agents can be biologic, such as bacteria and viruses. They can be physical forces, such as trauma, burns, or radiation. They can be chemical agents like poison or alcohol. They can be nutritional excesses or deficits, and there can be a molecular source, such as in sickle cell anemia, where a gene mutation results in the insertion of a valine amino acid at position 6 instead of glutamate. Most disease-causing agents are not specific, and many different agents can cause disease of a single organ. Most disease states do not have a single cause. Instead, the majority of diseases are multifactorial in origin. Multiple factors that predispose a person to a particular disease often are referred to as risk factors. Physicians like to group agents that cause disease into two broad categories. If the agents were present at birth, they are called congenital conditions. However, the manifestations may not be evident until later in life. Acquired defects are those that are caused by events that occur after birth. In the bottom picture on this slide, you see a man with gross skeletal deformity. He acquired due to a nutritional deficiency combined with exposure to high levels of fluorine from domestic coal combustion. Pathogenesis is the sequence of cellular and tissue events that take place from the time of initial contact with an etiologic agent until the ultimate expression of the disease. Morphology refers to the fundamental structure or form of cells or tissues. Morphological changes are oftentimes part of the pathogenesis in a particular disease. I have a picture here of the Hangover trailer, and for me I like to think of pathogenesis as events in the movie Hangover. Pathogenesis means that you have to backtrack a bit, just like the gentlemen had to backtrack once they woke up the next morning from their bachelor party. When they woke up, there was a lot of evidence in the hotel room to suggest that they had a wild and crazy night. They also realized that their friend is missing, so they have to retrace their steps to go back to the initial time when they realized that their cocktails had been spiked with a drug. The drug was the etiologic agent, and all of the events that led up to their missing friend could be considered pathogenesis.